Today's guest is Gareth Presch, a trailblazer with over 25 years of experience in healthcare innovation. In 2015, Gareth founded the World Health Innovation Summit, CIC, based in the heart of Cumbria. Drawing on international career in health systems, he also saw the need for communities to have better access to holistic local solutions, a vision he calls community-based, personal-centered care. With a commitment to good health and well-being as outlined in the UN Sustainable Development Goal 3, Gareth identified 5 key cornerstones essential for personal-centered health: health, economy, education, environment, and ecosystem. His approach ensures that all these pillars are supported simultaneously, creating a sustainable, interconnected foundation for better living. Join us as we explore Gareth's incredible journey from founding the World Health Innovation Summit in Cumbria to influencing global leader health systems, and his vision for transforming healthcare, empowering communities, and creating a healthier, more sustainable world. Find out why Gareth is really passionate about women's health, and as a father of 2, why it is really important to him. Gareth, welcome to the Her Spirit 50/50 What is Possible podcast.
It's a pleasure to be here. I'm delighted. Thank you very much for having me, Mel and Holly. I'm just excited to get into this conversation.
So we've probably just spent the last couple of minutes having a really great conversation. So we thought we need to press record and get this all on record. So it's great to have you here, Gareth, and to finally meet you. I know you know Mel quite well.
Yes. No, I'm absolutely delighted.
Gareth, we're obviously talking about women's health in this specific conversation. As a father of 2 and somebody that's worked in the health sector for, probably 2 to 3 decades, why is it so important for you to advocate for women's health and women's sport?
Well, you hit the nail on the head there when you mentioned, look, I have 2 young daughters, so I'm going to be an advocate for women's health. And we have such a gap in women's health at the moment. I don't know if the recent report, I think from the Royal College, states we've 700,000 women waiting for treatment for obs and gynae. I think also what's been what sort of pushed me towards this agenda is very much my mentor, my sort of leader of the future, my Professor John Bonner, who was the chairman of the National Haemophilia Council, was my boss. He was obstetrics and gynae. He set up the services in Ireland. And he had this very much, he worked with integrity, honesty, transparency. And I really believe in that. I think that's the future. I think healthcare also can pivot and bring a lot of investment into women's health. We just need to ask the right questions, really.
What kind of questions, Gareth, do you think we need to be asking? Because I think, as you say, that there is a lot of evidence out there to show that we know that there is a global health pandemic across all genders. We know that, the World Economic Forum has said that women spend 25% more of their lifetime in kind of poorer health. What are the kind of questions do you think that we aren't asking, that we're really understanding these issues and actually creating some solutions for them?
Well, I guess it's why, isn't it? Like, why do we have such disparity? I mean, it's the same goes for healthcare in general. I think we, as an individual, we don't think about, we always look at healthcare. Well, like, I get sick, I go to the doctor. You know what I mean? And that's always been a sort of like safety net. I guess we've got to bring it back to sort of even preconception, the family. We look at the social issues around mental health, mental well-being. What are the family structures that we put in place in the early years? I'm a big believer that if you put in those early interventions, you won't have to pay for them long term, which is what we're having to do at the moment. I mean, if you look at the impact of COVID on the UK health system, for example, look at the backlog of 7 million people waiting for health. Women's health is half, it's 50-50, but women don't get 50-50 of the share. If you look at the investment into women's health, I think it's less than 5%. I mean, that's just not acceptable. So we've got a long way to go and ask questions. And I think leadership, are we promoting the right leadership? Are we supporting the right leadership? These are sort of questions we have to ask.
And Gareth, what do you think the root cause is of that? Because I mean, that's shocking, isn't it? Women are getting less than 5% or 5% of that overall health kind of sort of budget. And yet we know that there are so many women's health issues where women just aren't getting treatment. What do you think the root causes of this?
Okay, so I've broken this down into a couple of points. So let's go through them. Okay, so societal and cultural norms. Okay, so women often face societal expectations, prioritizing caregiving, domestic responsibility, and they limit time for physical activity. Okay, and that's a fact. Women perform over 75% of unpaid care work globally. That's from the ILO. All right, now that's the first point. Second point is access to facilities. Women face barriers in accessing safe and affordable exercise space due to safety concerns and cultural restrictions. But again, a fact, 42% of women globally avoid exercise outdoors due to safety concerns. I mean, so this is a serious problem. Then we go to underrepresentation in research. I really want to focus on this as well, and we can talk a little bit more about this. But historically, a lack of female participation in health and sports studies has resulted in inadequate knowledge about women's unique health needs. Again, another fact. Women account for about 39% of participants in sports and exercise medicine research. All right, that's from the Sports Medicine Journal. Now, if we look at the economic disparities, lower wages and economic inequalities mean women have less disposable income for health and fitness activities. Again, another fact. Women globally earn 23% less than men on average, and that was from the World Economic Forum 2023. Now, health misconceptions. And this is a big one because I hear this quite a lot. Conditions like menstrual health, pregnancy, and menopause are often stigmatized and misunderstood, leading to a neglect in fitness support tailored to women. Right now, this is again another fact. Over 50% of women feel health issues such as menopause are not adequately addressed in health systems. So they're the sort of points that I would like to raise, and I think they're serious issues. And I think we need to address these and ask why.
I listened to all of those stats and they're pretty stark, aren't they, in the sense that you've got the societal point where we know women do it for the love of others before they do it for the love of themselves. We had a conversation, I think at the weekend, around, somebody looking for support of her, daughter. And the parents came round and they went, yeah, we're here to babysit. I'm just off to the gym. They went, oh, no, we don't look after that part of, we thought you were going out, that it's not culturally accepted. So we got lots of problems. We know that. It hasn't changed in decades. How are we going to solve it?
Yeah, well, I think this is where we've got to bring up strong women. So what encourages me is, so I'll give you my two daughters, for example. My 11-year-old will not let us walk past someone who's homeless without dragging me back and asking for money, okay, or to buy a sandwich. That's really powerful. She's 11, okay. And then when I asked her what does she want to be, in the future, she said, well, I want to be an artist and I want to help homeless people, okay. So that's really encouraging. And I think when you look at the statistics and you look at the demographics, younger people kind of are grappling with these issues and they're more susceptible. They're far more intelligent than when, they've got a better education. Just look at women's football, for example. So my two girls play football at the weekend and I'm amazed. I just love it when I go there and I'm watching this and I'm like, and it's an evolution. It's going to take a couple of decades. It's going to take time, but it's fantastic to see, girls active in that sport. Because back in my day, I don't want to give my age away, but that was never available for young girls. That just didn't happen. So it's quite encouraging. We are making change. There's a long, long way to go. I think, I don't know, we're probably 50 to 100 years behind the curve, but hopefully we can make that transition. I do believe, education in schools, so our WIS Kids programs, for example, can leverage that and open those doors.
How far do you think we've come, Gareth, on that whole cultural piece? Because I think, culture and cash are probably the two things that I think about most. What do we need to change in culture and what could we do if we actually had 50-50 cash in terms of women's health, women's physical activity, women's sport? Because I think I sort of, wonder if part of the challenges that we've got is that we're living in an age which feels pretty challenging. It doesn't feel very safe. It feels quite uncertain. It feels quite volatile. Everything that's happening in the US, in the Ukraine, in Israel, it feels like we're living in an age where we don't necessarily feel in control of everything that's kind of happening around us. And that sense of not being in control of our lives, health waiting lists spiraling. So if you're not well, you're not confident anymore that you're going to get the help and support that you need. How much is kind of poor health a symptom of a bunch of other societal factors, some of them which has probably been around for a very long time, just been accelerated by the current kind of climate that we're all kind of living in?
Yeah, I guess it's critical thinking, isn't it? And I guess it's sort of like the way we've been conditioned. We live in a fear-based economy. I do think we will begin to see changes over the next 10, 15 years with the acceleration of technology and adoption. And I think, again, it's perspective. So yes, we may feel, and certainly I noticed it, you will have noticed the rhetoric over social media. It feels like we haven't made any progress, but the reality is we actually have made incredible progress. And actually, when you look at the future around green technologies and the transition that's happening, I think it's quite positive. And even if you look at, like, we've made some good inroads in terms of bridging into the financial sector. The financial sector want to do good work as well, so there is that sort of sentiment of change. I don't think it's all doom and gloom. Like, I mean, you're highlighting issues that are very much at the forefront. But if you take a perspective and you step back and you look at it from a global perspective, and you do look at the cooperation, don't forget every day people do good stuff. There's people all over the world. We're fortunate we have the access to these tools to be able to elaborate what we're doing on the ground and articulate that vision. But if you take, areas of deprivation or lower middle income countries, and they need leadership and they need support to grow. But you'll find that there's a lot of people who are doing good work. They have the traits of empathy and kindness. I guess we just have to be factful again. But things are moving in a progressive way. I think UK and Europe also need to share wisdom. I think you're getting into a wisdom space here, which is not people just don't have time, unfortunately. That's probably where we're at the moment. We just need to take some time and think logically.
There just seems to be a disconnect, I guess, with what you're saying there, with the undoubted progress that we have made. It just feels that when you look at the facts around women's health, women's physical activity, women's sport, although there's been a couple of advances like women's football, I think probably the most notable. If you take women's football out of it, it doesn't feel like we're progressing at the same rate. There still feels like there is this lag, there is this huge gap and this inequality. So I guess it's, what is the fundamental problem? Is it an underlying misogyny that is running? And, we've had some of those conversations on the podcast about that. Is it fundamentally that actually some men don't want to give up their board place for actually some greater inclusion and diversity, which leads to better kind of outcomes? Seeing a couple of things going backwards, particularly in the sporting environment around leadership. We're certainly not seeing any advancement in investment or clarity around whether investment's even equal or sort of there's parity or equality in that investment. And without obviously sound like I'm a complete Debbie Downer, because I'm not trying to do that, but I think there's a reality. I think, you're a facts man. And I think the facts are that we don't seem to be making progress. And what we're trying to understand is why. What is really stopping it? Is it a lack of money? So when choices are made about money, the old theories and the old thinking, the data and the research that's there, which is less around women, gets primacy. Kind of what's going on in that system, do you think, that's stopping us making those advances?
Yeah, so let's start with, I've got about 6 points here that I want to just touch on. Okay, so firstly, there's insufficient funding. Women's health and sports initiatives receive disproportionately less investment compared to men's. And that's a fact. Okay, so you touched on it there. Only 4% of sports media coverage and sponsorship is allocated to women's sport globally. I mean, so that's, 96% is men. So we've a huge gap there, okay? We've got policy and leadership gaps, okay? So lack of women in leadership roles within health and sports governance results in slower advocacy for targeted interventions. That's a fact. Women only occupy about 14% of decision-making roles on international sports organizations. That's from the IOC. Gender bias in health systems, and this is huge. Persistent gender bias lead to women's health concerns being underdiagnosed or dismissed, all right? This is a total fact. Women are 50% more likely than men to be misdiagnosed after a heart attack, right? That's from the British Heart Foundation. We've got fragmented solutions. Many initiatives focus on short-term programs rather than systematic, scalable and sustainable solutions addressing the root causes. This is exactly what WIS is doing, what you're doing. Is, we need to take a long-term approach. Then there's the lack of education and awareness. Okay, so we've got limited public awareness campaigns about women's unique health and fitness needs in order to prevent behavioral change, right? So you're addressing this now. This is our podcast here. We need more of this. Then, of course, there's cultural resistance. And we touched on this. This was one of the points you were making. In some regions, it's deeply ingrained, that to hinder women's participation in physical activity and sports. All right. So in lower middle income countries, 80% of girls drop out of sports by the age of 18 due to societal pressures, and that's from UNICEF. So they're just the points I would like to raise to address these. I think the fundamental issue, if you peel it all back, is the funding issue, and we need to bridge gaps. We need to be able to work with the financial sector and the investors. And I think also we need to bring all our communities together to realize that there is an enormous gap. I'm a parent. We all, like women, it's 50-50. So we need to address this quite quick.
And it's an interesting one. And I listened to you very passionately talk about leadership, and going back to one of the statistics that Women in Sport talked about, that between 2020 and 2024, they saw a 2% decline in that kind of leadership. And that's shocking. So we talk about all the positive things, but it doesn't seem to be changing, does it? It seems to be declining.
Yeah, and I think then you have to ask why we don't have the support structure in place. I think also leadership now is becoming very political, so it's not necessarily around facts again. It's driven on a whim, That's why it's very difficult to be a politician. I mean, particularly in the current environment. I mean, and we need to look at that. I mean, what is the state of democracy? Which way do we want to go forward? Women are far more competent than men, and this is a fact. Okay, so, I mean, but I don't think that we have put in place enough to facilitate that change and that understanding. Again, this comes back to your perception as well. And also there is there's so much here around cultural issues and change, and this will take generations, unfortunately, the process of change here will be slow. It's not something that can be done overnight. This is where we're at, so you'll have a lot of, and this is what it takes time. And this is, if you're in this space and you're going to set out on this journey and you want to make that permanent change, don't expect this to happen in 2 weeks. That's not going to happen. It takes years of persistence, and it will take generations, and you need to be in it for the long haul. And that's something we need to build into the culture of society now, because the social fabrics and the way economics move, you just seen yesterday, we had the announcement of AI and this technology, and we've lost trillions off the stock market because someone brought out a cheaper version. So that's the sort of, and look, that happened very quickly, but the change we're talking about, that takes a lot longer, because you're talking about mindsets and changing behavioral, and that takes a long time and a lot of effort. That takes a significant amount of effort.
Just one of the points that you mentioned there, Gareth, and I think it's a really interesting point about leadership, and actually the climate which we're living in makes it difficult for people to even talk about the facts. And because if the facts don't suit a particular narrative or a particular point of view, those facts can be kind of denigrated, blown up, everything, and it can be quite difficult. And we've definitely seen that, I think, happen in the women's sports space, particularly around subjects like transgender. It's a very difficult, very complex, multi-layered issue that isn't as straightforward as yes or no. It's obviously presented that way, particularly around elite sport, which kind of has some very logical arguments, and then presented quite differently around community sport, which again have some very logical arguments. However, the issue that is there is around actually women's safety, actually how women feel about the spaces that they're in. And I think there's a lot of understanding that women aren't actually feeling confident enough to say how they really feel about that issue either way, actually. So, this is where it becomes quite complicated, doesn't it, to create some of the change that we're talking about, because speaking up for has actually become quite difficult. And there is a personal cost, and, plenty of people at that environment that have had quite a significant personal cost of actually trying to speak up for women, to try and help people understand why actually women's right to spaces, investment, healthcare, everything is really important. And I guess that may just be a time that we're living in. I hope I'm an optimist, I'm a pragmatist. It's probably cyclical, and that we will come out of this phase. And as you say, some of that progress that we've made will kind of sort of kick in. You obviously, decided to take matter into your own hands with setting up the World Health Innovation Summit. What led you to that moment where you said, I can see all these things that are happening. I can see that things aren't changing quickly. What led to that, and where are you going with that summit?
Yeah, it's a very great question. So look, I guess I spent 15 years in the Irish health sector. I was working at a senior level, and I joined the NHS then. I moved over here for family reasons to the UK. And I guess I got to the point where I could see internally, and this was 10 years ago, that the values within the health system were certainly changing. So we were there to help people, and I felt that didn't really align anymore with my values. So raising concerns, and that, like you say, you were being discriminated against or persecuted for raising genuine concerns. And so I felt like we had an opportunity to shift the dynamic from disease management to prevention. And then I left and said, well, initially the idea with World Health Innovation Summit was to support Cumbria, because, you could attract thought leaders to the region. And then, of course, you could attract staff, and you could bring people to the NHS and give them jobs, which is a huge monetary value, And then I got to meet a thought leader, a friend of mine who gave me some guidance, mentoring Professor Leif Edvindsen. And he said, well, look, you could bring this further, and you could start to implement programs in the schools and give a holistic approach. So with kids, with at work, stress management in the workplace, with seniors, falls prevention, loneliness, quality of life, with green, energy, waste and water, so you could build a whole ecosystem. These were the sort of pillars. And so I started to develop that idea. I prototyped it here in Cumbria. We developed programs in schools, and we measured it. And I measured it based on what I had learned in my previous roles in policy and how you would articulate that vision. That's sort of what brought me on that path. And I guess it was that need to see that change and understand that actually, I guess this goes back to sport. Do you know that? So I think I was 16, maybe. It was an under 12 or 13 match. I played football, and we got to the semi-final, and we got to a penalty shootout, and I was afraid to take the penalties, and we lost. And I guess that stuck in my mind. And then from that moment on, I decided I'm going to take the penalties. And I did throughout my career. Touch wood, I scored more than I missed. And that was that sense of responsibility. And I guess I've always had to look at things, well, look, you've got to take responsibility for this. You've got to do it. You can't, I don't think anyone likes public speaking, okay? But you've got to sometimes you're the one that has to get up there and do it. You've just got to go do it. So I think that's what we need. We need to encourage that. And it's particularly in women, we've got to give people a platform, support them. And let's not just put them up there and knock them down.
100%. And it makes me smile. It's about taking control of the situation. And that's the essence of Her Spirit. 8 years ago, myself and Holly sat there and were the grumpy women at the back of the conversation and said, you won't do it that way. You should do it my way. And we were passionate about making the change and said, we're going to create a solution to change the problem that we're trying to change, which is 2/3 of women globally aren't active enough for a health benefit. Every podcast, Gareth, I give a gift to our guest. And my gift to you is I have now elected you as Prime Minister. You can choose the location that you're going to be Prime Minister. If you were Prime Minister for a day, what would you change and why?
Well, very simply, the funding models. I would just make the NHS, the National Health Service, and just actually start promoting prevention at scale. And you would improve productivity. You create millions of new jobs. You would double the workforce in the NHS. I think we need to understand the financial mechanisms of economics as well, and ask more questions around the boost that would give the economy, which would be enormous. Instead of supporting disease management, you could pivot that, and all these jobs that are vacant at the moment, which of course, don't forget, grow the economy as well and bring economic growth as well. You just invert them and start promoting mental health and well-being in schools, and the economic benefits over the long term will be enormous. The economies that switch to this model, this is going to be the next economic wave, right? The visionaries, the future leaders who stand up and say, hang on, this is going to drive my economy by investing. And I'm not talking about a lot of money. This won't cost a lot of money either. And invest in preventative measures of healthcare and life sciences will grow their economies, multiple of times very quickly.
So, Gareth, your solution for Rachel Reeves and the growth that we're desperately seeking in the UK economy is good health. That's fundamentally what you're saying, that's the future of good economic prosperity for us and other countries around the world.
Yes, well, look, last year I was invited very kindly by the Ministry of Health in Finland. Now, Finland are seen to be the thought leaders of the world in this space. And they invited me and asked me to give a keynote on how do you do this? Okay, and I met with the ministry and I articulated how you do it. The money is already in the system. It's not difficult. You can anchor that into a circular economy. We already have nearly 200 billion swelling around the NHS. We have supply chains. This is why I was articulating about World Health Innovation Summit, bring it to each city. And then as a social enterprise, we can work with the existing ecosystem to sponsor our events and activities. Okay. We can create jobs in WIS-Kids in schools, right? And then that money is circulated and it's growth and it just continuously circulates and each local economy benefits from that growth. We also need ambition here, so when I see the Labour government or politicians, and as I said to you, don't forget, I was an advisor to a politician. I know this realm is very difficult, but I will be more than willing to have a chat with Rachel Reeves, Keir Starmer, any politician who wants to do this and do this correctly. Remember, we have done this. We have the how. We understand how to do this. We are in the process of working with financial institutions to bring that investment. So everything, the tools are there. We just need the will.
It feels like, Gareth, that certainly in the time that I've been in this whole health, physical activity space, that prevention is being talked about in every conversation now, and it seems to be front of mind. What's your thoughts around how you see this playing out now, whether, that potential is actually realised or whether we're still going to miss the opportunity? So I think there's lots of different thoughts about this, isn't it?
I don't think we're going to miss the opportunity. I think I think this is an evolution. As I said, I'm doing this 10 years. Okay. And I really think we've seeped in, and I got a message from Professor Bonner a couple of months ago saying, you've changed the face of healthcare. You've literally, because now the narrative is around health and economics. We were talking about this in 2015. So it's not, and this opportunity will be grasped. It will come and it will be taken. It absolutely. I think the UK, given the pressures that are on the NHS at the moment, is in a prime location. It's actually in its best position to take this and run with it. How it's delivered is what's going to be critical. It's interesting. We just recently launched the Radical Health Foundation, which is working with World Health Innovation Summit. One of the things I was talking to the sort of stakeholders, the board about was, well, the problem here is collaboration with commitment. Okay, so this we get all this collaboration. It's nice, and particularly around large scale corporations where they'll work with her spirit, but they don't really value you, like they're not valuing your intellectual property, your talent, your knowledge, your competency. This is also about competency here. Like, can you actually execute what you say? Can you do what you say, right? This is what's going to be key. So this is why I'm quite encouraged that I think that we are beginning to see this change, this seismic change. But be under no doubt, whoever develops this quickly will win out, because you're talking about human capital here. And that's the future. Everything is about knowledge management, wisdom. And if you can tap into that, keep in mind the vast majority of NASDAQ stocks are based on intangible assets, which is knowledge. So this is what we need to tap in. Think of the knowledge base within the health sector, right? It's huge. And what happens is it's just been sucked dry. It's not, and I'm not talking about commercialization. we also need to understand the funding principles of the NHS as well. Okay, it's not free. Please don't think it's free. Okay, we are paying for it. NHS drives the economy by keeping people fit and well. It's driving the economic growth. So keeping it free at the point of access is absolutely the right way to go. It's a model that should be sustained no matter what, in my opinion. Can it be sustained? Yes, it can. It's all about the values. You have to stop losing your best people. Okay, this is a fundamental problem that we have. So I'm optimistic. I'm very excited for the future, to be honest with you.
I just think we need more Gareths in the world, don't we? Having this conversation with that clarity, with that commitment, with that positivity. Just very quickly around physical activity, because it's a particular element of health, isn't it? That we've obviously, certainly Mel and I have spent decades engaged in thinking about trying to progress. What's your thoughts, Gareth, around some of the solutions around how we can get people more physically active, how we can remove some of those barriers that we know there are for women?
Yeah, I think this is hard. I don't think anyone will argue physical activity is hard. Okay, it's not something that's easy. And I think if you look at years ago, I put myself through the Ironman experience, and I played football for many years, and and I did it because it was basically for camaraderie. Like, I did it with my friends, and we had a bit of crack, and I really enjoyed it. And I look back at it now, and I think, God, I was mad doing that stuff. And even if when my daughter was running last week, she done cross country here, and she was selected for the county, and as she ran, and she was really tired. It takes a lot. Running is really hard. And I think all these things are hard, but the key again is to make it enjoyable at an early age and get it into, if you look at me, I was explaining to my kids, I had to cycle in and out of school, which was probably, the guts of 8 miles every day, 4 in, 4 out. And that's not really encouraged anymore, because we don't have the safety nets really in place. We don't have the bike lanes, you know what I mean? So there's things so we have to invest in the infrastructure as well. We've got to make it fun. We've got to make it enjoyable. And then, of course, when you get into the elite side of it, then that takes a different narrative as well. But I think overall, if you look, you're absolutely right. I think for example, if you just take the Ironman, which is sort of at the extreme level, I wouldn't be. But, the vast majority of people are not getting active at the weekend. Probably 95% of the UK are not active at the weekend, and that's not good. So we have to, how do we incentivize people? How do we encourage it? How do we make it fun? How do we make it more inclusive? I think football clubs can play a big role. These big sporting institutions can help in a big way. And don't forget, it's monetization for them. We have to explain the economics, keep your season ticket holders fit and well. More economic growth. So it's a win-win. These are simple things that we can address these problems.
What Ironman did you do?
I did France, I did Austria, and I did the UK. My first one was Sherburn.
Oh, okay.
So I did Sherborne, and it's interesting because it's a fact that I never knew about you. And I asked you the question, how do you like to stay active? And you talked about running and doing it for charity. But unbeknown to both of us, you are a triple Ironman. You are a legend, Gareth, an absolute triathlon legend.
Well, I think the charitable stuff is something that I'm very passionate about. Helping others is what I got into the health service for, because that's why I joined the health service. And then when it was just natural, so many things, working with the police service in Ireland, we raised so much money for children's cancer and for different wards, John's wards and Crumlin Hospital. So yeah, we should get out more active and do it for good causes, hence why we set up World Health Innovation Day.
And it is important to say that obviously you don't need to be doing Ironman distance triathlons to be fit, healthy and well. And I think actually what you said there about, as a nation, we're just not active at the weekends, which not for everybody, because if people work and weekends or work shifts, it may not be their free time. But I guess proportionately a vast number of the population do have more time at the weekends, and yet culturally it's not an activity that necessarily we look to as a nation. I think that's probably why something like parkrun has become such a great national institution, because every Saturday at 9 o'clock there is a free activity that you can go to, whatever level or whatever ability, and you can be active. So that's like changed the culture, hasn't it, on a Saturday morning? Parkrun is now part of that national cultural psyche.
Even parkrun, I don't think stretches enough. I think there's more we can do with parkrun. I think the parkrun could be an everyday activity. Why, you know what I mean? And also, like you say, it doesn't suit everyone to go Saturday morning because they may work or they may have family commitments. I know from my perspective, it's difficult because I have the 2 girls at the weekend in terms of having different activities. But you know what I think, what I really like about this conversation that we had as well is the honesty here. So you've got to be honest with the general public, and you've got to be honest and build trust at the local level. And you've got to tell it as it is and be just be factful. And then people have to ask the question, why is this happening and how do we address it? And then get to the root cause.
Yeah, because it's an interesting one, isn't it? There's kind of like 2 sides to the story, isn't there? There's a systemic issues and histories and barriers that are rolling, and there's also sort of cultural, person-centered ones. So there's an interesting one around the responsibility, I guess, of the state and the responsibility of the individual, which is just a really interesting one, isn't it? About actually what roles do we all play? What choices do we make? And that's a big part of what we've tried to do at Her Spirit, is to try and kind of, educate on one level to sort of understand kind of why actually activity is really good for your mental and physical health. But actually doing it, it's knowing it and doing it is completely different. And like you said, I think one of the challenges is that, I think parkrun's great. But on the other hand, I'd also say that there's too many people within the sector, the sport and activity sector, who think it is the solution for everything. And it isn't. It's certainly not for women, actually. So we know that from the stats around women going to parkrun. We know that there are a good few million people who are signing up to parkrun not turning up for the first time because it's intimidating, it's challenging, it's uncomfortable and all of those things. And I think we have to be having those conversations. And I think, again, that's the reason why, as leaders, you have to make that choice, don't you, Gareth? You want to be that person who decides not to take the penalty because you're too frightened, or are you going to step up and have a shoot at goal? And I think that's the journey that we've kind of interesting, the parallel been on. You've been at this for 10 years. We're kind of coming up for 7 years. And I think we recognise that to create change, you have to be the change, right? You have to actually create the doorway.
You mentioned the timeline. We're doing it a lot longer. I'm doing it 46 years. That's, so it's learning, you know what I mean? It's all learning. It's trial and error. And we'll make a lot more mistakes along the way.
Yeah. And I think it's that healthy piece, isn't it? About learning is about making mistakes, but you learn from them to change the way you think. And to close, Gareth, if a woman is listening to this and go, it's all well and good, I understand those statistics, what piece of advice would you give to inspire them to be active?
Well, take the plunge, I guess, isn't it? It's a case of just trust yourself. You have more competency than you have a lot of competency, to put it that way. Trust your experience, growth. Also, what's really important is growth comes from being uncomfortable, really pushing your own boundaries in terms of where can I reach? How far can I go? Interestingly, yesterday, I work with Dr. Shauna Padea, who's an astronaut with Virgin Galactic. And, I was talking to her yesterday. We're doing a project around space medicine and, we're looking at the financial structures of, the future growth in that economy. And she's consistently learning all the time. She's failing. And she's a real inspiration. Look for those characters that are out there that are doing it. Also, support each other. It's very important. This is not, so the area we're in here, for example, is not a big area. It's not a big space. There's not a lot of people doing what we are doing. There's not a lot of people sacrificing what we're doing for the rewards of the future. It's important to gather around those individuals and support them. That's a key objective.
Yeah, it's interesting to talk about comfort zone there, Gareth. And I can't remember which podcast I heard it on, but I think it was so true that it said actually one of the biggest sort of diseases, if you like, or problems that we have in society is comfort. So we've all become very comfortable with, sort of low risk and maybe not feeling uncomfortable or having those palpitations or the butterflies in the tummy. And I also wonder how much COVID's had an impact on that as well, where actually people's, confidence out in the environment has also changed. And I guess, we always say, and it is Dolly Parton that said this, but I think it's such a brilliant saying that, the magic happens outside of your comfort zone. And that's probably a great place to actually leave this, because it's been hugely interesting. Very loved all your facts, Gareth, but mostly loved the inspiration, the positivity, and the sense of actually as individuals, if we take those leadership roles, if we talk about the facts and have the difficult conversations, we've got an amazing chance of actually changing the way we all live, which is great. So thank you.
It's been a pleasure. They are very wise words, by the way.
Yeah, thank you, Gareth. Every time I speak to you, I feel so enthused and understand that what we are doing, because we are challenging society, we are challenging the institutions that we live in, it's worth it, because when we make the difference that we do, it's hugely rewarding, and very few people step up to do that. So thank you. It's been an utter pleasure. I do not want to do an Ironman with you, but I'm looking forward to our first run together.
Yes, definitely look forward to that. Anyway, my wife does not want me to do any more Ironmans.
Brilliant. Thanks, Gareth. A pleasure as always, and speak to you soon.
Thanks very much. It's been a pleasure.
Wow, that was such an interesting conversation, was it? We have so many facts, but the problem isn't changing. And I think the thing that I take from that conversation is culture and cash are so vitally important, as openness and honesty to collaborate is. If we were to put that into a box, how powerful would it be, eh?
Yeah, I think it is. I think the thing I really enjoyed about the conversation with Gareth was just his openness, his positivity. And I think what's definitely coming through in a lot of the conversations that we're having at the moment, both on the podcast and elsewhere, is this link between actually good health is good for global economics. And I wonder if there is this sense that things are shifting. And that's certainly the impression I got from Gareth, as he says, he's been going at this whole health inequalities sort of agenda for decades. It's challenging, it's complex, it's multi-layered, but actually we're starting to see some change and some tipping points. So yeah, I thought it was a really positive, optimistic conversation, despite the literal myriad of facts that he was able to share with us about women's health. I think the one that stood out to me, which I'm still pretty shocked about, is the fact that women only get 5% of the overall kind of health budget or benefit from it. I mean, I have to say, I think we probably spend our lives around physical activity, and we know the stats are pretty poor there, but that was quite shocking, actually. I don't know what you thought about that.
Yeah, very much so. And the statistics that he kept bringing out, that if you were to look through a half full lens, you would look at thinking, well, what's the point? And for us, it's about the positivity that we need to. Things are changing. We can change. I love what he said, do what you say. And I think that we are an example of that. And if we don't work together and truly collaborate, and we always talk about the Simon Sinek approach, don't we? That infinite mindset, things won't change. But I'm 100% in. I feel very enthused and inspired by the conversation, because there's no other way but doing what you say, is there?
Yeah, I mean, the battle for women's equality around health, and certainly sport and physical activity, can feel exhausting. It can feel dispiriting. It can feel quite lonely at times, actually. But I was just emboldened. I just felt like I wanted to put my armour back on, get my sword out, and take a bunch of us to run over that hill down to Parliament and say, come on, guys, we know the facts, we know things can change, and we have a perfect kind of opportunity, a perfect storm, if you like, that's happening within the world right now. So, yeah, brilliant conversation. And I'm sure we'll speak to Gareth again at some point.
We just have to go to Cumbria to collect Gareth to go back down to London. You have to run a little bit further now this time.